Hi everyone, I'm Sarah from health.com, and today we're going to be talking about the rise in back pain among millennials who are new to the work world. Joining me today is Dr. Charla Fischer. She's a spine surgeon at NYU Langone Health. Welcome.
Thanks for having me.
So you were saying that you've noticed an uptick in younger patients with back pain. What do you think's going on there?
I don't think that more younger patients are having back pain necessarily, but I think that they're having better access to healthcare. And with our society being very health focused and companies recognizing that the health of their employees is really important for productivity and happiness, that they just have better access to healthcare. And it's a better environment for someone who works in an office to say, I need to go see the doctor. There's less stigma and it's just easier access. And I see a lot of the millennials, mostly because they're making that transition between college life and, their bodies are adjusting to being office workers. And so I think that that's where some of the pain is coming from, and the fact that, access to healthcare is really important.
What is it about that change from the college life to the working life that might be bringing up some of those issues?
A couple of things. One is just being in an office all day. Mm-hmm. So when you're in college, you go to class and you're moving around and you're not necessarily sitting in one spot all day long. Mm-hmm. So that's one part of it. And the other part of it is the commute to the office. So either you're driving more than you were in college, or you're taking a train or a subway or walking more in the city. And so I think that sort of life routine just changes things up for people. And so that can be a little bit more of a back pain generator. Sitting in a car, stuck in traffic, if you're unfortunate to have to go through that, or bringing your bag with you on the train and maybe you don't get a seat that day, different things that can lead to back pain, in addition to then sitting in an office at a desk, at a computer for extended periods of time.
Right, and I think that's probably a big problem for people no matter their age, but for millennials in particular, what kind of work office behaviors are you seeing, like sitting at the computer, that might be causing these troubles?
So in younger patients, they're using more laptops. Mm-hmm. And so a lot of companies will give employees the option for a desktop or a laptop. And if you want to be able to work remotely, work from home, work-life balance, all great stuff, but then you're using a laptop. And so the ergonomics around laptops just aren't as good as if you set up a big monitor that's at eye level. So everyone in the office should be able to sit with their feet flat on the ground, knees at 90 degrees, hips at 90 degrees, back well supported, a lumbar support in their chair, and then the keyboard down to lap level. That helps you to relax your shoulders, and then monitor at eye level so you're not craning your neck up or down either way. Laptops are usually around here and your screen is here, and so the patients are sort of moving in down towards the laptop more. Laptops are great because you can take it with you to different meetings, you can travel with it, you always have access, but it's just important to be aware that that can lead to poor ergonomics while you're working.
I'm definitely familiar with that position you just made. Are there specific parts of the back that kind of slouching over your laptop is hurting, like lower back, upper back?
So it hurts both. And so the upper back, usually along the trapezius muscle here, mm-hmm. The trapezius is this big muscle, sort of a diamond shape that goes from the back of the head into the shoulders and then comes back down into the middle of the back. Mm-hmm. And so along here, along the shoulders, that can really get cramped up and tightened. And then also the lower back just gets too much of a stress if you're leaning forward just slightly. And so really we want to sort of think about leaning back more, and the laptops just cause you to do the exact opposite position. And so having pain across the shoulders, really tight shoulders, is very, very common. And then just low back achiness just in general.
Okay.
And that's not damaging the vertebral bodies, the disc bases, mm-hmm. spinal cord or nerve roots. That's all the muscles of the back. And so that's why talking to young patients about getting those muscles healthy and strong and good ergonomics is really rewarding, because they can really sort of solve this problem when they're younger as opposed to older.
That's great to know. So what can they do now to kind of prevent worsening down the line?
So first thing I want them to do is to work on their ergonomics at work, just to sort of be cognizant of that, and also to take frequent breaks at work. So sometimes I tell patients, set a timer on your phone for every 30 minutes, because every time you'll notice, if you're working after 30 minutes, you're kind of doing this. And so if the timer goes off, then it's a little cue to, okay, sit back, readjust, maybe take a break, go for a walk, look outside. Adjusting the focus of your eyes is really helpful for maintaining good eye health and then relaxing your entire body. I never wore glasses until med school, and then reading like this, that really strained my eyes, so then I had to get glasses and contacts. So just educating these young people that if you develop certain habits now, you can prevent these from being issues long term. Older patients have different types of issues, more arthritis-based, and that's wear and tear of the joints and the disc spaces, which can happen over time from genetics, just life. But these issues in younger patients are in the muscles and can really be solved by sort of looking at ergonomics. Other things they can do when you're at the gym, just focusing on core and back muscles, as well as the inside border of the shoulder blades, more fly type exercises like this, really strengthening those muscles. So things like bar is really great, yoga, Pilates, those are good to sort of maintain good health. If I see a patient and they've been having a lot of pain for a while, I'll have them do physical therapy, which is good treatment, and then Pilates, yoga, bar, that's good maintenance once they're getting better.
Great. It seems like more offices are taking the ergonomics thing seriously now.
Yeah.
We see a lot more standing desks than we used to. Do you think that that's something people should look into?
I think standing desks are great. I think in general, offices and managers are more open and aware and in tune to this issue of back and neck pain in their office workers. So I think that it's easier for them to get access to either an ergonomic consult, someone to come evaluate their workspace. I spoke with one patient who had the computer here and then the phone here, and so they were kind of working like this. I'm like, that's a big setup for problems. Years ago, a few years ago, I used to have to write a note to get a patient a standing desk. Now, after talking to a patient, I'll say, do you need a note for your company to give you a standing desk? And patients look at me, what? No, why? I'm like, no reason. It just used to be harder for people to get standing desks. So I think it's really great that companies are recognizing that ergonomics is important. And a lot of the offices have different workspaces. Like you can go work on a couch, you can go work over somewhere else because everyone's on a laptop and it's remote, which is really good. It's just important to change positions every so often and just keep in mind your alignment while you're working.
That's great. Now, what do you want young people to know about back pain? Because like you said, older patients have different issues. I get the sense that younger people might think it's not something they need to worry about now, but what would you tell them?
I would say that developing good habits now can lead to a lifetime of less pain. And so, sometimes I'll see patients who are older and they say, I've been having neck pain since I was 20. Like, well, maybe we could have made some modifications when you were 20 so you don't have that pain for the next 40 years. So, getting good habits, good lifestyle, staying healthy, eating right, are all good things to maintain good back health. And then thinking about, there's a phrase, sitting is the new smoking. And so just sort of keeping that in mind and staying active outside of the office, making sure you're doing your exercise at the gym and incorporating some core exercises. And so if you do that and you stay on top of it, then a lot of these aches and pains should improve, and then you won't have to deal with it for the entire time that you're working.
Do you have any suggestions for little exercises someone might be able to do right in their desk chair that either fixes their posture or helps with back pain right off the bat?
So a couple of things that you can do to sort of modify where you're sitting is you can get lumbar support. That's always helpful. making sure that your chair is adjustable so that you can get comfortable and get in a good ergonomic position. And then certain exercises are really helpful. Some things people don't think about is that they're kind of always leaning forward. And so just chin tucks, just, you know, tucking your chin back a couple times. And then, you know, just stretching. You can do some like neck stretches from side to side. Those are always helpful. And then if your lower back is bothering you, you know, just standing up and sort of stretching forwards and backwards. And these are just sort of like office and chair type yoga things that are really helpful.
Great. Well, thank you so much for being here. Thank you, Dr. Fischer, and thanks everyone for watching. For more great health information, please go to health.com and like us on Facebook.